Keloid. So that is the topic for now. So after ear piercing, some patients they may complain a swelling like this at the site of piercing. This is called as keloid. This is more common in dark skinned people and it has got a genetic predisposition also, and it is common in a particular race too. Now, what is the cause of keloid? Why it is common in some particular race, and what is the pathophysiology behind this? Let us go to that in short so that you can understand. So the main cause for the formation of keloid is at the site of piercing or the trauma, there is excess deposition of collagen or elastin or fibronectin like that. Why does it happen so? I'll explain to you in short. See, in keloid prone patients, if there is an injury, the injury heals in 3 stages. The first stage is inflammatory stage, where there is a flow of blood and all the blood cells to the site of injury, followed by the second stage where it's called as a proliferative stage, where there is deposition of the fibers which I have mentioned, mainly collagen. So the lot of fibers will be deposited at the site of injury, one above the other in layers, followed by the third stage, that is the remodeling stage, where whatever collagen is necessary, it gets deposited over that injury area, and whatever is not necessary, it is removed, and that wound area is remodeled in such a way that it goes back to the natural structure. How it looks natural, like that it goes back to the natural. Now, in keloid prone patients, what happens? There is imbalance between the second stage and the third stage. So there is deposition which becomes excess. Why? The remodeling doesn't take place. So there are some enzymes which controls this second and the third stage. So when there is a deficiency or imbalance in the production of the enzyme, it is not able to control the second and the third stage properly. So you have excess deposition of the fibers. If the deposition is only over the site of injury and limited to the site of injury, it's called hypertrophic scar. Now, when it exceeds beyond the area and it goes to the neighbor area, extends to the neighboring area, it is called as the keloid. You know what does a keloid mean? Keloid means the crab pinchers. You know the crab pincers, how it walks. It looks like that. The appearance of that, if you see if it looks like that, it looks like a crab pincher. So it is named as keloid. That is the word meaning of that. Now the common presentation of the patient complaint will be, they say with a history that there is a history of ear piercing or some trauma, followed by that there is a swelling like this, and the patient will complain of pain and itching too. Coming to the treatment part. If the keloid is very small and the patient if we can avoid a surgery, means I will tell the patient, if it is very small, please leave it alone. Please do not do anything. Why? Because keloid, the recurrence rate after removal is very high. It is from 70 to 90% if only surgery is done. So if it is a small keloid, please try to avoid surgery and try to avoid any second ear piercing or any trauma too. That is important. But if the keloid is significant in size and the patient is saying that no doctor, I want it to be removed, in that case we can do a surgery with a scalpel, the blade, or we can removal. It can be with a laser too. Soon after removal, soon after surgery, we can inject any one of these 4. Either it can be steroid, that is triamcinolone, the first one which I mentioned, or it can be 5-fluorouracil or bleomycin, or it can be even interferons. That is soon after surgery. Now, after surgery, we opt for any one of these 5. Why? So that the recurrence rate is reduced as much as possible. The first one is reapplication of steroids, triamcinolone. Some hospitals, they have a protocol of after 2 weeks, the second shot, Then after 1 month, there's a third shot. Other hospitals, other doctors have different protocols. Whichever your physician follows, please follow his instruction. And along with that, you can wear silicone sheathing over the injury, over the site of surgery. That has to be worn every day for full 1 year, continuously. And other alternative is you can apply cream twice daily. Now, some centers, they advise for radiotherapy, but what you have to do, when you have planned for surgery, you have to get an appointment with the radiotherapist first and tell him the date of surgery, so that soon after surgery, you go meet him so that he can expose you for 2 days session, 2 sessions or 2 day sessions for radiotherapy. That's why. And in some other centers, instead of these applications, they opt for mitomycin application soon after surgery and the second application after 3 weeks. So this is in short about keloid. So the take home message, most important is, if it is small, try not to remove it and avoid a second piercing. And only if necessary, go in for surgery, because even after all this, still there's a chance of recurrence. That's why. Thank you so much.